September 13th marks National Celiac Disease Awareness Day, a disease that's triggered by consumption of the protein called gluten, which is found in wheat, barley, and rye. Here are some eye-opening statistics about celiac disease from celiacdisease.com. It takes an average of 11 years for patients to be properly diagnosed with celiac, even though a simple blood test exists. Celiac disease affects more people in the U.S. than Crohn's disease, cystic fibrosis, multiple sclerosis, and Parkinson's disease combined. 1 out of every 133 Americans, about 3 million people, has celiac. There are currently no prescription medications available to treat celiac disease. The specialists at Advanced Gastroenterology and Surgery Associates explain celiac disease and how it's treated.
Celiac disease is actually an autoimmune condition where the body, essentially in layman term, causes antibodies that will not allow the GI or the small bowel to absorb wheat products. Now, the reason why celiac disease is becoming more commonly known is because of the awareness in diagnosing the condition.
Celiac disease is actually very common. It's supposed to be 1 in 100 people. Like many other areas of disease processes, some patients may have it very mild, some may have it very extensively. So it's a very common condition. It's a gluten-sensitive enteropathy where people have sort of allergies to gluten products like rye, wheat, and barley. So pastas, rice, a lot of carbohydrate foods have gluten, and the patients develop this autoimmune reaction to these products, and it develops, they develop what's called a malabsorption or sloughing of the small intestinal mucosa specifically, so that they don't absorb or digest properly. And patients can come in with significant symptoms of severe weight loss, abdominal pain, bloating. And some patients may be very mild, may just have a little bloating, a little bit of loose bowel movement. So any patient that we actually see with diarrheal symptoms or bloating, they should be checked for celiac disease because it's easily treatable. The treatment is just diet.
Patients will come to our office and say, well, you know, Dr. Trey and I have been on a gluten-free diet and I feel much better. I would say to them, well, if this makes you feel better, then this is something that you can stay on, but to be gluten-free, strictly gluten-free diet is very difficult.
We now realize that some patients may have what's called gluten sensitivity, meaning that they don't actually get the disease with the malabsorptive problems, but they may get some mild symptoms, a little bit of bloating, a little bit of loose bowel movements when they use products high in gluten. So those patients actually, with the celiac disease panel becoming normal, but just using a gluten-free diet, they actually feel better. So it really is a healthy lifestyle.
Celiac disease is a very common problem that often goes undiagnosed. If you'd like to find out more about the testing and treatment options offered at Advanced Gastroenterology and Surgery Associates, please click the Celiac Awareness Story link icon on our homepage, yourhometownhealth.com.